Temporomandibular joint ankylosis, or Tmj Ankylosis, occurs when the joint becomes fused, limiting jaw movement and causing functional and aesthetic issues. Kaban'S protocol, developed by Dr. Samuel Kaban, is a well-established surgical approach aimed at restoring function to the joint. The protocol includes 3 key steps. Joint resection. The first step is the removal of the ankylosed tissue. This typically involves resecting the condyle, the glenoid fossa, and the articular disc to create a new joint space. Complete removal of the affected tissue is crucial to prevent recurrence. Interpositional graft. To prevent re-ankylosis, a graft is placed between the newly created joint surfaces. Common materials include autogenous cartilage or bone grafts, though allogeneic grafts may also be used. This step is critical for maintaining the joint space and promoting mobility. Joint reconstruction. Finally, a prosthetic joint or custom implant is inserted to restore function. The implant mimics the natural movement of the TMJ, allowing for improved jaw opening, closing, and lateral motion. This step ensures long-term functional outcomes. Benefits of Kaban'S protocol include restored jaw movement, pain relief, improved oral function, and enhanced facial aesthetics. However, there are potential complications such as re-ankylosis, infection, nerve damage, or limited jaw movement. Postoperative care involves immobilization, physical therapy to enhance mobility, and regular follow-ups to monitor healing and prevent complications. Kaban'S protocol remains a highly effective approach for Tmj ankylosis, providing both functional and aesthetic improvements, especially in severe cases.